Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing acne, or what is popularly known as pimples. Acne is primarily a disease of the teenage, occurring between the ages of 14 to 17 in females and 16 to 19 in males. 1% of men or 5% of women between the age of 25 to 40 might still have acne or might even develop it at this stage. For those that develop it during this age group, it is known as late onset acne. Acne is caused by stimulation of hormones which produce more sebum or oily substance in the skin. Because of this oily substance, the skin that should normally be shed, that is the dead skin, is now clogged up within the pores. When it is clogged up, it now appears black, which is what is known as blackheads or the black comedones. When it is released out into the surface, it is called whitehead. There's a bacterium that is normally on the skin, which is a Propionibacterium acnes. For some people that are susceptible, the bacterium now mixes with the excess sebum, and then it now makes the bacterium to multiply more and thrive. Because it multiplies, it now causes more inflammation. And when severe, infection can occur and you can get pus-filled pimples, which are pustules. When this development is not arrested, scarring can now occur and even things like keloids can develop. In dark-skinned people, there's a risk of hyperpigmentation. There's some common misconceptions about acne. One, it is not caused by infection per se, so it's not infectious. You cannot get it by touching the person. Two, it is not caused by poor hygiene. In fact, aggressive washing is discouraged. It's encouraged to wash not more than 2 times a day with a gentle fragrance-free cleanser, and also to use makeup that does not encourage pimple formation, which is called non-comedogenic, and also to use a good moisturizer. Some other causes of pimples include some medications, things like anabolic steroids, oral or topical corticosteroids, lithium, and even some homeopathic treatments that contain iodide. Excessive progesterone can predispose to pimples, and conditions like polycystic ovarian syndrome or PCOS can predispose to that, most likely due to the excessive progesterone in the body. Stress might contribute to the development of acne. Some people have said foods can aggravate acne. It has been found that foods that have a high glycemic index, things like sugars, ice cream, or bottled drinks, might aggravate acne. And that is why foods with low glycemic index, like fruits and vegetables and whole grains, are encouraged. The treatment of acne depends on the stage of the acne and how it presents. Generally, like mentioned before, keep good hygiene. Probably taking foods with low glycemic index can help. In all stages of acne, topical retinoids are encouraged, but be careful if you are pregnant or planning pregnancy. For dark-skinned individuals, there's a risk of hyperpigmentation, so azelaic acid can be added in. Treatment should be for at least 12 weeks, and if not effective, there should be a change of treatment. For severe cases, a referral to the dermatologist should be considered, where retinoids, oral retinoids can be used, or lasers. Always remember to treat acne early. Early treatment makes complications to be reduced. And we need to remember the complications of acne are not just physical but also psychological. It can bring down a person's self-esteem, so please seek treatment early. Don't forget to watch this video as many times as possible, share and subscribe to my channel. And until next week, smile because it's healthy. Bye.